Now, as you know, with many of these debates, much of the decision-making as well, they all rely on statistics. We've been overwhelmed by stats. We fret over them every day when it comes to this pandemic. But a Melbourne academic associate professor, Kim Sawyer, has looked carefully at our pandemic response from a statistical point of view, in particular the impact of lockdowns. In a paper last year, he wrote that the pandemic response is an exercise in risk management, and that the objective is to minimise the risk of infection and the mortality rate. But there's also the risk to the well-being of those who are not infected. We need to minimise all risks, says Associate Professor Sawyer, including the risk of unintended consequences. We can't be too singular in our approach. Kim Sawyer, thanks for joining us live from Melbourne. What's the statistical evidence so far on the cost versus the benefits to the wider community of our pandemic lockdowns?
Well, I think the costs are going to be realised in the future. I think we've got a problem here that the risks of the unintended risks are going to take 5 or 10 years to estimate. So we don't really know. But the studies that have been done about the costs and benefits suggest that the costs are very high. Not just the realised costs at the present time, but the costs of uncertainty, the costs of not making decisions, not just economic decisions, but social decisions. We're seeing that every day. And those risks are not being factored in. I make the point, though, just on I saw your exchange there in South Australia. One of the great mistakes of this pandemic has been to focus on the number of cases. The cases underestimate significantly the real number of cases. They always have. Antibody studies overseas, and indeed in Australia, the small number show that the number of cases is probably tenfold what we're actually seeing. And that changes the equation. If in fact one case is really 10 cases, and most of them are asymptomatic, it gives people a different measure of the risk that we're facing. And that's what we have to come to terms with. We can't lock down cities with 3 or 4 cases. The virus is out there. We have to start focusing on what you're focusing on, which is the case mortality rate. And that's essentially how many, if you get a case, if you get infected, what are your chances of being in hospital or of dying? And that's really what the focus of statistics has to be on that. And that's where the founder of epidemiology, he focused on that. Sorry, Chris.
Yeah, Kim Sawyer, we talked a lot more about those other statistics earlier in the pandemic, I think. This is one of the reasons I think we're a victim of our own success. We treat every infection as some sort of a disaster. You talked too about selectivity bias in statistics, and that's, of course, because everyone getting tested, or most people getting tested in this country, are people who are worried they've come in contact or people who have got symptoms. So you get a different picture there. You're suggesting we should have random sampling of the population.
I wrote that in March last year. I wrote an article in the Financial Review and a lot of statisticians supported me. We should have been sampling. We should have been going out in the community and sampling and finding the asymptomatic. We have completely misrepresented this virus. This virus is based on the asymptomatic people. They're the spreaders. They're the ones we have to find before they spread. And we know from evidence that there are super spreaders. What people don't understand is that 80% roughly of the people who get the virus don't transmit it. It's only 20% that transmit the virus. And we have within that group some super spreaders. Most of them are young, they're mobile, and they're asymptomatic. They're the people we've got to find. Our approach has been completely wrong. We wait for people to get symptoms to go and get tested. Sure, we've got to do that, but we've actually got to get ahead of the curve. We've got to find the asymptomatic before they spread. That has been our biggest mistake.
Just one other point, getting back to the effect of lockdowns, it's very easy for us to see how many people are infected. It's very easy for us to see, of course, how many people lose their job or close down their businesses. But how do we measure the other consequences? How would statisticians measure how many people are missing other medical appointments or missing out on elective surgery or succumbing to mental health issues and the like?
Well, that is going to be realised later on. We won't we won't measure these sort of risks until maybe 5 years later. So that's going to be a long-term problem. My suggestion at the present time would be to get out of this lockdown mentality. We have to release ourselves from being... The virus has got us prisoners. We've got to release ourselves. We have to get back to a normal life. The only passport to normality is to actually bring in rapid testing, rapid antigen testing. And that's been done in the United States. That's we're seeing that. The US FDA approved that in March, end of March. UK, Switzerland, Germany have all approved that. So basically what we've got to do, we've got to go down that approach. We have to...
Yep, thank you.
I would
sorry to cut you off, Professor. Sorry to cut you off, Kim Sawyer. We are out of time. I appreciate that, and that's definitely a path we need to do more on this country. That is rapid testing. That's Associate Professor Kim Sawyer there from Melbourne University. The other path, of course, is vaccination, and this is what I was trying to get to the Premier and Chief Health Officer in this state today. What level of vaccination before we can kiss goodbye to lockdowns and restrictions? Many of us would have thought, and this is what was talked about a year ago, once we get the vulnerable vaccinated, then would be okay to ease up and take a little bit of a more open approach. Doesn't seem to be what we're talking about now, does it?